This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
As
Supposed to
second.
help first or
Medical Dilemma.
Hi, I'm Sonny Del Rosario, and you're watching Medical Dilemma. Our physical appearance, no matter how much we deny it, is basically the first impression that we give others. No wonder we spend a lot on our looks. Our guest for the first segment is Dr. Esther C. Laines, a practicing dermatologist from the Makati Medical Center. She's a graduate of the UST College of Medicine who did her residency in internal medicine also at the Makati Medical Center. She was the first head of the MMC Laser Center, one of the pioneers in cutaneous laser surgery in the Philippines. She was also the first chair of the Laser Subspecialty Group of the Philippine Dermatological Society. Welcome to the show, Dr. Laines.
Thank you. Thank you for inviting me for today.
Yes, it's really a pleasure to have you today in our show. Okay, Dr. Laines, maybe we should first talk about your specialty, okay, which is dermatology. Okay, how did you get into the field of dermatology?
It was actually a different twist in my plan. Actually, I was a resident internal medicine at Makati Medical Center. And then during that time, there was no fellowship yet for any subspecialty. So all of us would go to UPPGH for our subspecialty or fellowship.
Okay.
And at that time, the only subspecialty that is available in UPPGH was hematology and dermatology.
And dermatology.
So I had to choose between the two, and I chose dermatology.
You chose dermatology.
Yes.
So it's more of like no other choice.
Yeah, because to me, hematology is a little bit, how do you call that? It makes me depressed to see children suffer.
I see.
So, especially those with leukemia. So, I think I would like to go into something that is more exciting.
More exciting,
like dermatology.
more positive.
Yes,
Okay.
more positive.
Okay, so where you see a lot of beautiful people, I suppose.
Yes, yes, a lot, actually.
Okay, that's nice to know. You said that you were the first head of the Laser Center of Makati Medical Center. Okay, and laser surgery was, I suppose, was a very new field when you started
Yeah,
out.
when we were started.
Okay. So could you give us a brief background of how laser surgery developed?
In Makati Medical
Yes.
Center. Yes, actually, we had the first laser center, and our laser were actually hand-me-downs from ophthalmology. So we had only two lasers during that time, the CO2 laser and the argon laser. And then I think nobody was using it in our
Okay.
department. So I had to go abroad to the U.S. To study cutaneous laser surgery. That's about 1992 to 1993. And at that time, the laser surgery, what they call that, a course is still
Yes,
in its infancy. So I was lucky to have the best in laser surgery as my mentors. They were also pioneers and they were authors of books. So I really had a good teacher. I had a good foundation of knowledge, and so that time I was one of the few who were using the lasers.
Okay.
So that's why when something is starting, the others would be afraid to use it, like the lasers.
Yes.
But as the time went on, like now, almost all dermatologists are using the lasers
Laser.
now.
Okay. Now, cutaneous surgery, okay, for the purpose of our audience, what exactly does it mean?
Okay, cutaneous means skin. Laser means the use of lasers in dermatology. So there are a lot of uses of lasers in dermatology. And if you would like me to continue, it can be used for pigmented lesions, for vascular lesions, most especially those lesions in the face that will cause disfigurement if you do surgery. And it's also used for tattoos, and then for, of course, photorejuvenation. You can use it. The laser is very good in photorejuvenation.
Now, laser, as I understand it, is a highly concentrated light. Okay? So, I'm
Yes.
just interested in the technological aspect of
Yes,
the
yes. That's the
application.
reason why the laser can be used for dermatology, because of its characteristics. It's coherent. It means the laser waves are together.
Yes.
So unlike the ordinary light, like this bulb, it goes out.
It's
It's
dispersed.
diffused.
Correct,
It's dispersed. And then coherent, they stick together. And then when you point it in one, it goes into straight line. And then another characteristic of laser is it penetrates the skin.
Okay.
And it reacts with a chromophore, something the skin that absorbs the light. So in the skin, if there is a light absorption, the light that is absorbed is transformed into heat, and that's the one that works on the pathology that you would like to treat.
Okay, so it's the heat that
Yeah,
is
it's the heat that's
generated.
transformed.
That's the one that
The
treats.
light, it transforms into heat, and it's the one that acts. The advantage of laser is because since it's specific, it has a chromophore, it goes to the area that has to be treated. Now, it really depends on how you do it. Like, there are parameters, there are settings in the lasers that you have to use properly in order to avoid complications. So what are these complications? Number one is the pigmentary change. It can be hypo or hyperpigmentation. And
Which
another
means you could
you
become
can
darker?
it becomes darker. Like if you
Yes.
go deep and you destroy the pigments,
Yes.
you have hypopigmentation.
Okay.
And then even if you're in that area, but it stimulates the melanin, and it's very common among Asians, you have hyperpigmentation.
Oh, okay. So you can
And-
actually become lighter or darker depending
Yeah,
on
but
what is hit by
in
the laser.
Asians, usually become darker.
Oh, you become darker.
Yeah. But that's part of the treatment. You can, in time, it improves, and also with treatment like lightening creams, it goes back to the
Original state.
color.
Ah, okay.
Now, another is scarring. Now,
Scarring, yes.
scarring can be atrophic, can be hypertrophic. And that's the problem, because scarring and these textural alterations can be caused by bad parameters. It means the setting is not proper.
Yes.
So it's very important that a doctor or a dermatologist should operate the laser for dermatologic treatments.
Okay. Now, talking about applications,
Yes.
I suppose there are applications for making us look better, look more beautiful, or maybe more handsome. And there are other applications that are actually for treatment of certain conditions.
Yes. Yes.
Let's start first with the treatment of certain conditions. What are these conditions?
Yeah, typically the vascular lesions, like
Vascular
the hemangiomas, the port wine stain. If you see it in port wine stain can be seen in newborn children. And this is very good. Like, for example, we can actually do early treatment in infancies. Now, so in order to avoid the spread of the lesion, and also because of the psychological effect that goes with the child, especially if the lesion is in the face. So, like, for example, the hemangioma, which I have seen patients who had it here in between the eyes.
In between the eyes,
And then if it's in a stage that it still proliferates, lumalaki, that's the one that is very risky for the intrusion into the eyes, no? So you actually don't treat right away. You wait for it or for it to pass the proliferative stage, and then you see there are other ways to treat that also by medical treatment, propranolol in infancy. Now, if you want to treat it, that's advantageous because now you don't have to excise it.
Okay.
Especially if it's already in the areas of the eyes, the nose, the ears, and the mouth.
I see. Is this a very common condition?
Yeah, hemangioma. Hemangioma is fairly common in the Philippines.
Fairly common.
Yes, and also port wine stain.
Okay. Are we Filipinos very predisposed to such things compared to other nationalities?
Actually, there's no racial predisposition, but because we actually see it in most cases, in
I
most
see.
races.
Okay. Now, going over to the aesthetic side of laser
Yes.
applications, what is the usually demanded service from you?
Yeah, actually now it's not only the lasers. There are so many other modalities that has emerged from the laser, like the radio frequency,
Yes.
the ultrasound. So you can use the ultrasound for photorejuvenation. The main goal in photorejuvenation is to increase collagen production.
Collagen
Production, and also increase the elastin fibers that give suppleness
More
to the
supple,
skin. Yeah,
again.
so you regain the youthfulness that you do, especially in older individuals who still want to have a good skin. You can have this treatment. So now there are treatments that you only do once in a year or several times. Usually, it's like lasers, it should be done several times
Okay.
with monthly intervals. No? Also, intense pulse light. Intense pulse light is not a laser, but it also causes increased collagen production. And then, of course, the radio frequency, which is very common, exemplified by Thermads. You can do it once a year.
Yes.
So there are many things that Thermads can do, radio frequency, and there are other radio frequencies now that are available. So we have the unipolar, bipolar, tripolar. These are all the things that has the innovations in radio frequency. And then the ultrasound is a little bit painful, but if you are very desirous of being young again,
Okay.
yeah, it's also done once or twice a year.
Once or
The
twice a year.
ultrasound. So now you can use it not only for diagnostic purposes, but also for rejuvenation, skin.
Really? So
Yes.
it's the same ultrasound machine?
Yes. No, it's not the same ultrasound machine. It's a different. They constructed in a different
it's a
way.
different,
And
yes.
the ultrasound that is used for photorejuvenation is so high tech because you can see what level you are. Yeah,
I
it's
see.
a little bit painful, but the result is very good.
All right, Doctora, we'll take a break for a while. Dear audience, don't leave this channel. We'll be right back after a few words from our sponsors.
Nervous ako doon sa-
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other words can